It's been almost a fortnight since Wales's largest health board was returned to special measures amid concerns over safety, performance and quality. And while many people do receive good care in North Wales, tonight we're hearing from some of those who still have concerns. From Denbighshire, our health reporter Katie Fenton has this special report.
Meet Maya Dowell and Maya Roberts. They share much more than just a name and a love for knitting. Both are retired nurses. Both had long careers at Ysbyty Glan Clwyd. And both have something to say about what's going on in Betsi Cadwaladr University Health Board. Maya Roberts spent several years as the risk and litigation manager. But last month it was her turn to be the patient. And she was shocked by what she saw from the hospital bed.
As a patient, you feel vulnerable anyway. And as a nurse, you know how things should be. There was a day that they were too busy to do drinks. They were busy and delaying answering bells. It wasn't their fault. There wasn't enough for them to do it. I felt I almost wanted to be well enough to get out of bed and help them, to be honest.
Maya Dowell worked in the emergency department, one of the most problematic areas of the hospital. But she remembers it before troubled times.
You were proud to work there, and it was known as being, for a long time, one of the top 10 hospitals in the UK. And because of that, you had people coming from all over the world to train here. Now they can't attract staff at all because of the name Betsi Cadwaladr. It's got such a bad name.
You were there during the first period of special measures. How did that affect the hospital in your eyes?
I think we all felt, oh, this is awful, we're in special measures. But to be quite honest, I didn't see it made any difference at all. Everything just carried on the same.
How does it feel to see the hospital you spent an entire career in the state it's in now?
It's heartbreaking. I was there when it opened, and I've always counted it as my hospital, and I've always felt very, very proud of it. But the thought now of going into the hospital, it certainly worries you.
Ysbyty Glan Clwyd is one of the areas the Welsh Government has said needs particular attention during special measures. But we've been here before, so what's going wrong?
So there are problems. I would say there's also a fantastic amount of good work going on in the building behind us as we're talking. But there are real problems that have been deep-seated and sitting within this hospital, but also other parts of the health board for a long time. Special measures seeks to really understand the reasons for that and then what the long-term solution is.
How can people in North Wales have faith that special measures is going to make a difference this time round when many would say it didn't last time?
And I could understand the cynicism and the doubt that some people watching this might have because they've heard this before. I think the only assurance I can provide is that we really are looking to make things right, to really be open and transparent about where issues are, not try to hide them or to cover them up.
But for these two, it's going to take a lot to restore faith in the hospital they once loved.
How confident do you feel that things are going to improve?
As things are now, I've got no confidence at all.
To see the way they work, I wouldn't want to go in and be a patient again.
This is a hospital steeped in historical failings and a health board with a long road ahead. Katie Fenton, ITV News in Denbighshire.